Ready, we are going to go ahead and get started with today's webinar. I'd like to welcome you all to our Health and Education Policy Update webinar. We're excited you all could join us and hope that you enjoy our webinar today. My name is Alex Mays, and I'm the National Program Director of Healthy Schools Campaign, which is the organization that is hosting today's webinar. I'll also be moderating the webinar and just wanted to start us off very quickly with some logistics. Our webinar is going to run for about an hour, and we will have a recording of the webinar and slides from today's presentations available, and we'll send a link out to both of those following the webinar. Most likely it will come out middle of next week, so look out for that. We also have a very quick survey at the end of the webinar that we would appreciate it if you could take and provide your feedback on today's presentations. We'll save time at the very end of the webinar for question and answer. So we'll make sure we get to your questions. You can send them in throughout the webinar by typing them in to the questions box, which is on your control panel. And just type those in, hit send. We'll be collecting them, send them in throughout the webinar, and then we'll make sure we get to them at the end. We have a great lineup of speakers today on our webinar. I'm pleased to be joined by John Hill from the National Alliance for Medicaid and Education, Sasha Pudelski from AASA, the School Superintendents Association, and Lena O'Rourke, who is presenting on behalf of Healthy Schools Campaign. So on the next slide, you will see the objectives for today's webinar. And I just want to highlight that today's webinar is really going to focus on the policy levers that are driving health and education right now and how those levers can impact states and school districts and schools in a variety of ways. I want to emphasize that we're going to be focusing at a very high level today and want to give you that big picture overview of changes that are happening in terms of education and health policy and how those impact school health and wellness with a focus on school health services. We know that a number of the actions that have been taken by the new administration and Congress are going to have an impact on health and Medicaid and education, and unfortunately not necessarily a positive impact. And so today's webinar really is going to focus on the facts of what has changed in terms of health and education policy, and then hopefully provide you all with some key takeaways of what you can do in your communities and your states about how to be involved in this work and help support health and wellness and make sure that student health remains a priority. So we are going to, I'm going to be providing an overview of the Every Student Succeeds Act and sort of the education policy world. We're going to go do a deep dive on Medicaid waivers, and then we're going to address the uncertainty around health reform as well. So that is the lineup for today. So let's go to the next slide then, and I will kick us off just by spending a little bit of time focusing in on the education policy side of things and providing an update on the Every Student Succeeds Act. So next slide, please. The Every Student Succeeds Act is the newest version of the Elementary and Secondary Education Act, which was most recently known as No Child Left Behind. And this is the nation's education law, and it really it made a number of key changes that we see as really presenting an opportunity to support student health and wellness. The law includes a significant focus on supporting the whole child and includes a number of changes that do that, which I'll go into momentarily. And that's really why we wanted to spend some time focusing on it today, just to provide you all with an update of where that implementation of this law is and kind of what has changed in recent months, so that you're aware of kind of those opportunities for supporting health and wellness. So the Every Student Succeeds Act is very much undergoing implementation right now. States are actively in the process of figuring out how to implement this law. It was passed in December 2015 by the Obama administration and had bipartisan support, and which is very important in this context. And really, in addition to including a much greater focus on the whole child, shifted significant power and authority to the states in terms of how to implement their vision for supporting student education. And so I think that's also very important to remember in this context, is that it really did, there's guardrails in place from the federal government, but it really has transitioned a lot of the authority to states. As I said, states are very much in the process of implementing this new law. There are 2 deadlines that states can use to create and submit their state education plans. One was April 3rd, and then the next is mid-September. So there have been a first batch of state plans that have come in. I'll speak to those a little later, but 16 states and Washington, D.C. have submitted those plans. So states, again, are very much moving forward with this. Next slide. And so just to highlight very briefly, I mentioned that the Every Student Succeeds Act includes a number of opportunities for supporting student health and wellness and certainly school health services. So those opportunities we really see around Titles 1, 2, and 4. So Title I is the program that includes funding to states and school districts with high percentages of low-income children. And this program, a number of changes were made around creating safe and supportive school environments and really addressing school quality and, again, the whole child instead of just focusing on academic outcomes. So specifically, under the new law, states are required to include a measure of school quality and student success in their state accountability system. So these are the systems that are used to identify schools that are underperforming and need more targeted support. And so having this measure of school quality in there creates a really important opportunity to address a number of issues, but certainly including health and wellness. And it's not required that states use that measure of school quality to address health and wellness, but certainly creates the opportunity to, and that is very much what we're seeing states think about as they're coming up with their draft plans. Title I also requires states to include on their report cards a number of measures that school districts are already reporting to the Department of Education's Office for Civil Rights around school climate and safety and violence and chronic absenteeism. And so, again, these report cards are sort of the public-facing accountability system that anybody can go and access for a school in their community. And having those measures of more related to school climate and health and wellness creates a really important chance to better understand kind of what the conditions of health and wellness and what school climate is within those individual schools. And then Title II, which addresses professional development and literacy under the new law, has a tremendous amount of flexibility in terms of how that funding can be used. Under the previous version, under No Child Left Behind, professional development funding really could only be used to support core kind of academic competencies. And under the new law, there's a lot of flexibility in terms of how that funding can be used. And the law specifically calls out that the professional development funding can be used to train school staff around how to address chronic absenteeism, around how to establish mental health partnerships, around how to support mental health and physical health. So a number of great opportunities there as well. And then finally, Title IV, which includes the student support and academic enrichment grants and community supports for school success, is a program that, again, creates important opportunities around health and wellness. Specifically, the student support and academic enrichment grant program combined 49 separate grant programs into one pool of funding, and specifically requires that a percentage of that funding be used to support safe and healthy schools. And in addition, that funding is intended to be used to ensure that all students have access to well-rounded education and to equip schools with effective technology as well. I will speak in a minute a little bit more about where that funding is currently for that program. So next slide. So getting to kind of our topic of today, of the updates on where Every Student Succeeds Act is now and what has been happening in recent months. So I think one of the biggest changes that I wanted to highlight is that recently the new administration in March, using the Congressional Review Act, repealed accountability and teacher preparation regulations that were released by the Obama administration. So those regulations were rolled back, and subsequently a new template was released for states to use in developing their plans that outlined how they were going to implement the new law. The Obama administration had their own template, and so this new template is intended to replace that one and align with the repeal of the regulations. The important thing to remember about this, and what we've really been emphasizing, is that yes, the new administration repealed the regulations, which really outline how the Obama administration kind of saw, implementation of ESSA playing out, but all the opportunities that I highlighted earlier around Title I, Title II, and Title IV for supporting student health and wellness are in the law and are not changed by the repeal of these regulations. The regulations provide clarity to states. They help states think through how to really implement this law, but it does not, repealing them does not change the core intent of the law, and those measures, the requirement to include measures of school quality and student success and accountability systems are still there. The requirements around report cards are still there. And so I think that is really what we've been emphasizing. And the other thing is that the regulations were repealed in March, and as I mentioned, the law was passed in December 2015. And so many states were very deep into developing their plans and implementing this new law. And so it really, we have seen them moving forward and really not changing their course of action based on the regulations repeal. There certainly are some states that will do that, but many, this regulations repeal does not require states to change what they've been doing. They can submit their state plan using the old template. And so it does still, those opportunities for health and wellness are still there. And then the other big change is in terms of funding that has been allotted for Title IV Part A, which is the Student Support and Academic Enrichment Grants program that I mentioned earlier. I said that the program combines 49 separate grant programs into one pool of funding, and that program within the law had been authorized at $1.65 billion. And unfortunately, in terms of the fiscal year 2017 appropriations, the program was only given $400 million, so just a fraction of that $1.65 billion. And the program was originally intended to be rolled out through a formula, so meaning that most school districts would get some level of funding based on the funding that they were receiving through Title I. And with the lower amount of funding, the program, the appropriations included language that allows states to run this program now as a competitive award program. So that certainly changes the intent too. So we were very disappointed to see the funding for this program so low, and advocates are working very actively to see if more funding can be awarded in coming fiscal years. But I think the important thing to also remember on this front is that, certainly there are still those opportunities, again, within Title I and Title II are still there for supporting health and wellness, and there's no restriction saying that funding can't be used to support, health and wellness efforts. And as I chronic absenteeism, certainly we've seen school districts, thinking about innovative ways to use Title I funding to create safe and supportive school environments. So there are still, opportunities to use resources to support health and wellness. Next slide, please. So just very briefly, I wanted to go through a quick update on kind of where states are in terms of their implementation of the new law. These are the 17 that have submitted their state plans to the Department of Education for spring peer review. So this is the group that submitted for the first deadline. Again, the second deadline is middle of September. And so if your state is not on this list, then they are very much actively in the process of developing their state plans around this, and there's a chance to provide feedback on the development of that state plan. And then on the next slide, you'll see that just kind of a quick overview of those 17 state plans in terms of what they're thinking of for that measure of school quality in their accountability systems that I mentioned earlier. And 11 of the 17 have included chronic absenteeism as a measure of school quality, which is great because, again, as I mentioned, it's not required that that school quality measure address health and wellness. And we really see chronic absenteeism, which captures unexcused and excused absences, as an important proxy measure for health and wellness. And then additional health-related school quality measures that are in these accountability systems include measures related to physical fitness, school climate, student engagement. So we're seeing a lot of great things in terms of how states are thinking about that measure of school quality. And then next slide just outlines if your state is in the process of developing their plan, if you're interested in kind of learning more about the opportunities that ESSA presents for supporting health and wellness, I'd recommend checking out this framework that we put out earlier this year with the Alliance for a Healthier Generation, which includes more details. And then finally, on the next slide, I just, again, want to emphasize that very much, these plans are in the process of being developed in those states that have not yet submitted their plans. So if your state is not on that list, I would encourage you to go to your State Board of Education website, learn about where they are in terms of that process, and provide input. The 2017-2018 school year is going to be the transition year for data collection, and then the law will go into full implementation in the 2018-2019 school year. So next slide. So I am now we're going to switch gears from education policy, and Lena O'Rourke is going to provide a similar overview of the Medicaid from the HHS perspective. So just very briefly to introduce you to Lena. Lena is an experienced healthcare advocate and strategist, and her work specializes in legislative and regulatory strategy on Medicaid. She spent over 7 years doing consulting to a wide range of nonprofits, including Healthy Schools Campaign. And before that, Lena spent over a decade at Families USA, where she was the Director of Government Affairs. So we are pleased to have Lena joining us today. And Lena, go ahead and take it away and provide an overview of things from the Medicaid waivers perspective.
Thank you so much, Alex. I'm going to be focusing my remarks, as Alex said, really on what the U.S. Department of Health and Human Services, and specifically the Centers for Medicare and Medicaid Services, or CMS, has said and done to date on the regulatory front. And I know there's a lot going on Medicaid right now, and I know that this piece is probably the least flashy part of everything that's happening on Medicaid. But believe me, the direction being set by CMS is critically important to understanding the direction of Medicaid over the next couple of years, and will have a tremendous impact on states, on beneficiaries, and on schools. And this work will happen regardless of what's happening with Congress, and which John and Sasha will cover in a minute. But this is ongoing, and it's happening, and it's at the state and local level. So for many of you, this is stuff at home that you can be engaged in, need to know about, and understand where the Medicaid regulatory front is going. Next slide, please. So let me just level set with some facts you probably already know. Medicaid is a federal and state partnership program that provides comprehensive health insurance to low-income children and their families, as well as other adults. And it has tremendous coverage for children. 39% of all children, almost 40% of all kids are covered by Medicaid. And almost half of all Medicaid beneficiaries are children. And we know that kids who are eligible for Medicaid do better in school. They missed fewer school days. They are more likely to finish high school, attend college, graduate from college, and have fewer emergency room visits. And schools and school districts provide a lot of those services. And only about 1% of federal Medicaid dollars go to schools. That's $4 billion that is coming into schools through Medicaid. Next slide, please. Today, schools are paying, schools use Medicaid to help pay for a lot of different services, like vaccinations and vision and hearing screenings and mental health services. And Medicaid also helps provide services to students, including those with IEPs and those who are served by the Maternal and Child Health Block Grant. And it's a critical source of funding for states and schools to provide services and increase access to children's services, to children's health and behavioral health services. And what's more, recent federal policy change out of the Obama administration opened the door to expanding the type of services that Medicaid will pay for in school-based settings. So this means that, taken together, all school districts are already working with Medicaid and billing and states are states are paying for services in schools, but schools and school districts could do so much more to help provide efficient services to where kids are, and Medicaid really plays a foundational role in that development. Next slide, please. So what does this have to do with this new administration, and what does this all mean for Medicaid in the new administration? And we got the first glimpse of it when the new CMS administrator, Seema Verma, along with Secretary of HHS, Tom Price, released a letter to the governors, and actually CMS Administrator Verma's first day in office. They released a letter to the governors on Medicaid reform. And the letter says, I'm just going to read it, "Today we commit to ushering in a new era for federal and state Medicaid partnerships, where states have more freedom to design programs that meet the spectrum of diverse needs of their Medicaid population. States, as administrators of this program, are in the best position to assess the unique needs of their respective Medicaid-eligible populations and to drive reforms that result in better health outcomes." Next slide, please. So what does that mean, and why did I quote that to you? It means the administration is actively giving states permission to pursue state-level policy agendas and to really advance their individual population-level goals. This is not new. Medicaid has a lot of tools to help states. Medicaid already offers a lot of flexibility to states to design their programs. These types of tools include Medicaid waivers, and specifically a lot of states are pursuing the 1115 waivers, which let states advance demonstrations and new policy proposals. State plan amendments, which are another opportunity to advance state-level policy change, and other levels of state reform are built in there too. But let's put on our decoder rings for just a minute and think about what this really means. It means the administration is actively encouraging states to come up with ideas that are unique to their states, and to think about how they serve their Medicaid beneficiaries. And CMS has the authority to approve or dismiss the waivers, and that's always been the case. So at some level, this is an opportunity to advance state-level agendas, particularly those that are efficient and save money for the state and do a better job of coordinating, and states have always had the flexibility to do this. It's one of the beauties of the Medicaid program. But sometimes these waivers are being used to advance a political agenda at the state level, and we've seen a number of these proposals brewing and many more in the queue. So at a state level, these waivers are something to watch and to listen for and to keep your ears open and your decoder rings on so you can really see between the lines, read between the lines and see what goals the state is really pushing for. Is it just cutting the program, or is it actually advancing the goals of the Medicaid program? Next slide, please. So the administration has also signaled that it wants to revisit some of the existing Medicaid regulations that it considers burdensome to states. As context, they have particularly singled out the Medicaid Managed Care Rule and the Home and Community-Based Services Rule. These were both promulgated under the Obama administration, and the new administration would like to give these waivers these regulations a second look. But it's also under this Medicaid policy and regulation bucket that the free care rule falls. And honestly, at this time, there's been no public pronouncements at all, really, on the future of the free care policy. So we don't know what's going to happen there. It has not been identified, as I've seen, as a target to pull back. And I think we can make an extremely good case, as with many of these regulations, that this is good policy. Schools are local solutions. They are innovative. They work together across state silos of education and Medicaid to give states the local controls to make decisions for their students. It's efficient care. It's where the students are. and it really advances all of the goals of this administration. And so we at the Healthy Schools Campaign and all of us on this call will be really monitoring for what the administration plans to do on the free care policy. And we'll be sharing that as it goes, but I encourage everyone to be thinking about this at the state and local level as well, so we can lift up the good policies here and hopefully take advantage of this, this continued good policy. And Alex, I'm going to turn it back to you. I will just say, you know, the administration is giving states these tools to pursue their own policies, but they're also waiting to see what's happening in Congress. So as we move into the next section of this, Alex, I'll toss it back to you to talk about the bigger picture issues that are going on.
Great, thank you so much, Lena. And so next, actually, we're going to hand it over to Sasha Podolsky from AASA, who is going to, as Lena said, talk about some of those bigger picture issues that are going on in terms of the legislative activity and helping us understand what's at stake in terms of Medicaid and school health. So Sasha is the Assistant Director of Policy and Advocacy at AASA, and she joined their team in 2010 as part of their AASA's advocacy team. She helps represent the organization's priorities on Capitol Hill, including those related to the Individuals with Disabilities in Education Act, Medicaid, English language learners, and rural education. So we are pleased to have Sasha joining us today. She has been doing a tremendous job leading work around supporting and defending Medicaid in schools, and we greatly appreciate her taking the time to join us today. So Sasha, I will now hand it over to you to talk about some of the bigger picture issues that are at play right now.
Great, thank you, Alex, and it's been so wonderful to have Healthy School Campaign involved in this important work that we're doing on Capitol Hill. Next slide. The American Health Care Act is what I'm going to start talking about, and that is legislation that should be familiar to many of you. It's what passed the House earlier in May, and it was a vote that was very close, 217 to 213. It was a real nail-biter. All the Democrats voted against the bill, and 20 Republicans also voted against the bill. Those were mainly moderates who thought the bill went too far in terms of rolling back protections or changing policies around Medicaid expansion. And so, as you probably read, the passage of the bill came weeks after lots of backroom dealing and wheeling. And members had less than actually 24 hours to really read the bill before they voted on it. So it was not Washington transparency at its best by any means. In fact, arguably it was at its worst. And the bill essentially will allow a few different things that I think are problematic for a wide variety of organizations that care about, you know, the welfare of kids. It allows health plans to charge more to certain people and to offer less services than they have to under Obamacare. It will dramatically increase the number of people who are uninsured. It will slash hundreds of billions of dollars from the Medicaid program, and I'll talk about that in a minute. And then it does all of this so that we can provide tax cuts for wealthy Americans. That is the goal of this, to figure out a way of shifting the funding that we're spending on providing low-income Americans, people with disabilities, healthcare services, so that we can provide tax cuts to the wealthy. And it's just, no matter what political persuasion you are, it's very hard to argue with that as a fact. Next slide, please. So AHCAA fundamentally changes Medicaid. I think Lena talked in her bit about how Medicaid is an entitlement program. It's a federal-state partnership, and it's an entitlement in the sense that if you're Medicaid eligible, you're guaranteed certain services, and the state, for providing those services, will be reimbursed appropriately by the federal government. This completely changes that idea. Medicaid under this legislation no longer is an entitlement. It's something now that states have, quote-unquote, more flexibility to provide, and as Lena pointed out, there's already a lot of things like the 1115 waivers and legislation, and there's a lot of flexibility already for states to craft Medicaid programs based on the population of people that they want to serve and what they want to do to improve health benefits for them or healthcare outcomes. But what this really does is say, you know what, we need to disinvest. The federal government is spending too much money on Medicaid, and we need to cut it by about, the recent estimate from the Congressional Budget Office is $830-ish billion in over 10 years, so that states will be able to figure out how they want to run their programs, and we'll give them all this flexibility to do it, and as a result, we won't need to spend as much money, and we'll stop having costs that escalate every year that are unanticipated sometimes, because as an entitlement, you never know what your spending is going to be. You spend what you have to. That's the beauty of having something that's an entitlement program in this country. So they say we don't want to do that anymore. We don't want to be on the hook for costs for people that we can't anticipate. So we want to convert Medicaid financing into what they call a per capita cap, which is essentially just a big block grant. And for those of you in the education world, you know very well the danger of a block grant. It's very easy to cut, first and foremost, and it's very easy to kind of manipulate as well. And so that's why we're always wary of block grants in the education space, and I'm sure that's true in the health space as well. Now, the AHCA does not change the list of covered services that states have to provide to traditional Medicaid beneficiaries. But what's going to happen is that at some point, the federal government is going to stop paying what they've been paying. And that's the goal again, to provide tax cuts and pay less. So the state is going to have to provide the money for the services and make up the difference from the federal government. And that means, unfortunately, because of the state budget crises that already exist in this country, that states will be forced to ration and cap some of the optional services they're providing to beneficiaries or to stay within their budget number. And in fact, the way the law is written is actually if the state kind of goes over and spends too much, they actually have to pay money back to the federal government. So there's a real impact here on quote-unquote promoting efficiency on the part of the state. But many experts already believe that Medicaid is a very efficient program, and so that's not really going to change once the states have a lot of more quote-unquote control over the program. Now, what's going to happen is the shortfall in federal funding is projected to grow over time. And once the link between federal funding and actual costs is disconnected, it will be really tempting for Congress to change the measures that they use to currently dole out dollars even further, to disinvest even more. And as a result, what's going to happen is that states will be in a position of having to choose who is a Medicaid eligible provider, what kind of services that they need to receive, and this is how it will impact school districts. So I'm getting ahead of myself. Next slide. So specifically, this legislation eliminates this idea of a federal match for the expansion population. You're aware, of course, that under Obamacare, many states took advantage of the opportunity to expand enrollment for Medicaid to primarily adults, but certainly children are part of the marketplaces as well that states have set up. That means that states can cover people up to 133% of the federal poverty line. And under this, they would no longer be able to do that. They would have to go back to 100% of the federal poverty line. In addition, Medicaid expansion is going to result in significant coverage reductions and as well as increased uninsured rate, both among people who are low income more broadly speaking, as well as people who are specifically in vulnerable populations like older Americans. It's anticipated that larger uninsured rates will occur in these expansion states like Ohio, for example, and Nevada, compared to non-expansion states. And additional research also suggests that Medicaid expansion that's helped to reduce income and race-based coverage disparities will be completely eliminated. Next slide. Now, the impact on Medicaid changes on children, well, first and foremost, it threatens the guarantee that they will receive the coverage they need. And specifically, there is something that's been a hallmark of the Medicaid program for a long time called EPSDT, Early Periodic Screening, Detection, and Treatment, Diagnostic and Treatment, I believe it stands for. It's a mouthful. And these are the kinds of basic health screenings that kids are entitled to that schools can provide, but any medical provider can provide, can also do. That ensures that, first of all, they're screened appropriately to make sure they don't have anything that can be remedied quickly that may impact their ability to thrive as an adult, and that they get the treatment that they need. And all of that treatment and prevention is covered by Medicaid. It is a guarantee for a child in the Medicaid program that you have access to this. And it's expensive, right? Because it's completely comprehensive in the sense that if a child walks through the doors and they're having trouble breathing, for example, because they have undiagnosed asthma, that a provider in a school setting, for example, can do a screening for asthma, can monitor that child, can connect them with someone who can help them and get them an inhaler or whatever other medications they may need. They can work with the parent on how to prevent the asthma the child may be experiencing. They can look to see if it's related to an allergy. All of that stuff is considered EPSDT. And as a result, it's an expensive part of the Medicaid program for a lot of states. And so governors, for one, have expressed a desire not to have to comply with that mandate. So it's unclear whether or not with this legislation, whether they would suddenly say, you know what, that EPSDT stuff, we're not going to do that anymore. And as a result, children's health will be certainly impacted in a negative way. It also ties the hands of states in terms of decreasing their ability to respond to new treatments or public health crises. So when it comes to, for example, Zika, you know, if we suddenly have a major outbreak this summer and this bill was in effect, for example, healthcare costs would rise. But under this legislation, if it was in effect, the cost that states would be given, the money that states would be given from the federal government wouldn't necessarily change in response to this major and costly health outbreak happening that impacts kids and newborns and women. So it's not necessarily responsive to the health costs and the health circumstances that states may be experiencing, which is problematic. But it also puts pressure on other parts of the state budget, including education. Education is typically one of the top 3 expenses the state has. And so if we're suddenly states are on the hook for paying for more Medicaid coverage because the federal government is paying less, that will have an indirect but very profound impact on the education budget as well, because we'll get squeezed as a result of needing to come up with dollars that the state may or may not have to meet its Medicaid commitment. Next slide, please. And as a result, what we think will likely happen is as the federal government shifts the cost to states, states will be curbing Medicaid payments to providers, including schools, and again, cutting education services to balance the budget. Next slide. So the implications for school-based Medicaid are the following. While Medicaid decisions are going to be in the hands of states, which is the goal for Republicans, they're going to have a lot of tough decisions to make and not a lot of funding to make those decisions work out so well. So, you know, it's our view that it's highly likely that if schools are in a position where they have to compete with hospitals and providers, emergency care rooms, urgent care clinics, et cetera, for limited funding, that governors and state Medicaid directors aren't going to say, you know what, schools are deserving of those funds because we're not clinics, we're not frontline healthcare providers. They're going to say those people are the ones who need some resources first. Schools can do without. And that's just an assumption that we make based on what, you know, pragmatic, the part of these folks who are going to have very difficult situations on their hands where they're going to have a lot of money to make up since the federal government isn't meeting its commitments any longer. So what that means for schools is that we could lose at least, it's our view, 30% of the Medicaid funding we receive. But I think, frankly, it's more likely in some states that we'll lose all of our Medicaid dollars. So that will, in turn, result in the fact that states are going to slash reimbursement for specialized instructional support personnel in school settings. And providers are going to be forced to leave schools, which will create even bigger access problems, as well as issues around noncompliance with IDEA. And states will have too little Medicaid funding to meet kids' needs. And so we really believe this is going to take critical resources away from schools and students and lead them to not receive the health and care services that they need to learn. Next slide. And we anticipated this happening in January based on the conversations on Capitol Hill. And so my organization, AASA, did a survey of about 1,000 school leaders in 40 states where we asked them, for example, what would happen if you got a 30% cut, being kind of optimistic about what would happen. And, you know, these are some of the results we received. Overwhelming responses from school leaders that students with disabilities and students in poverty will be harmed. services will be reduced for those individuals. Someone just said very succinctly, a 30% reduction in our Medicaid dollars, which we use primarily for mental health. It will mean a 30% reduction in services for kids who need mental health. And so that's one very straightforward way of looking at it, but the impact is much larger, of course, because so many districts have recently taken steps to increase Medicaid enrollment in their districts. And the economic consequences, particularly for districts that are the primary employer in the community, are very high. I think we're going to be forced to furlough staff or lay off staff, try in some instance to raise taxes if that's possible to compensate for this. In terms of the general education budget, we already shift a lot of dollars to special education because of the unfulfilled mandate to fund IDEA at 40% at the federal level. So, we're going to see that exacerbated as a result of losing these Medicaid funds, which are often used to supplement that IDEA shortfall. And the school districts that have been cutting already are going to have to cut even farther to try and shift the costs away from the general education population into special education. So that will definitely impact every kid, regardless of their income bracket, regardless of whether they have a disability or not, if general education programs are being cut to compensate for the loss of Medicaid funds. And finally, there were folks who said, listen, I'm barely complying in terms of IDEA already with the dollars that I have. This will kill our district. You will not be able to serve kids with disabilities if Medicaid goes away, especially if we can't get providers in our schools. So next slide, please. So we asked them also, what do you use your Medicaid reimbursement in your district for? Because there was a lot of confusion about it. And 2/3 of districts said we use them to provide salaries for health professionals to provide services for students. About 45% said they use it to expand health-related services. 40% said they use it to facilitate outreach and coordination to refer kids to services. And about a quarter said they use it for other things, typically transportation, specialized equipment that a child may need, kind of equipment for medically fragile kids, for example, or kids with significant disabilities, assistive technology. All of those things are Medicaid reimbursable. And with that, I guess I would say that, we've been using this report a lot on Capitol Hill to try to drive this point home that Medicaid reimbursement is such an important stream. It's only 1% of the overall Medicaid dollars that go to school districts, but if you look at that in terms of what we get for other programs, it's a lot of money. It's actually the 3rd largest federal funding stream. It's about $4 billion. So IDEA is around $13 billion, and yet, we get $4 billion for Medicaid. So it's an important federal funding stream for districts, and we're really scared about what will happen if this legislation continues to move forward in the Senate and we move to our per capita system and the impact that will have on kids' ability to learn in schools and our ability to ensure they're successful after school. And with that, I'll hand things over back to Alex.
Great. Thank you so much, Sasha, for that really helpful and comprehensive overview. We really appreciate you sharing all your expertise on this topic, and hopefully if people have questions about all the information Sasha shared, please feel free to type them in through the questions box and we'll get to them at the end. So wrapping us up in terms of our presentations, I'm now going to hand it over to John Hill, who's going to kind of provide us with an analysis of the current environment and share some more information about what you can do in your state to work on these issues and just continue to make sure people understand the important role that school health services play in student success. So John is the Executive Director for the National Alliance for Medicaid in Education, and his career is focused on state and federal level policy affecting individuals with disabilities. And so most recently, John was at the Indiana Department of Education working on issues including addressing racial and ethnic disproportionality in special education and acting as the department's liaison with the state Medicaid agency. John officially retired from state service in March 2014, but we are very fortunate that he has continued his leadership role with NAME and has been a wonderful partner and advocate in this work. So John, I will now hand it over to you.
Thank you very much, Alex. Next slide, please. Transitions. Whenever there's administrative change, it's always hard. And what we have now is it's not just administrative change, but it was a political change. And it makes it a lot more difficult for people. They are resetting policies, they're resetting directions. Nobody's really certain where it's going. It's hard on us. It's also hard on the federal staff that have been there a long time. And we just have to take a deep breath and kind of hold them for a little while until they can get their positions filled, which will take a lot of time. Unfortunately, in this particular instance, it's not only a change or a different group of folks coming in to run things. It's almost like a hostile takeover. And people are really inside and outside, as you know, are very nervous about how this could lead and the impact that it's going to have on kids is particularly, at least that's our biggest concern. And we'll just have to wait to see a little bit, but we can continue to remind people on what it is we're doing. Next slide, please. What's going on in the different states right now, like everybody else, there's a lot of uncertainty about the future. What's Medicaid going to look like? What's it going to be? The thing that we always have to keep in mind, healthcare is always changing. It's always going to change. We never have it right. We'll never have it right. It'll continue to evolve. This is a great opportunity. At least it can turn out to be a great opportunity. But as Sasha had mentioned, there is the potential of major cost shifts from the federal level back to the states. If the states want to maintain or increase the services that they're delivering under the current Medicaid funding formula, where it's a shared responsibility between the federal and the states, that more and more of that burden will fall on the states as they expand. And the things that we have to keep in mind is we know it will expand, and we'll know it expands for two reasons. One is costs will continue to go up. They'll always go up. So if you're only getting a fixed amount of money from the federal government, that cost increase will mostly have to be borne by the states. Not only will the costs go up, our disability population is always increasing. So the numbers of people that are needing services are going to continue to increase, again, along with those costs. So this does put the states in a very, very difficult situation. They will have to weigh out where it is that they want to put their money in order to provide services. And part of that is that we're going to have to remind them that schools are a very efficient and effective way to deliver healthcare services. As Sasha had alluded to, we're going to be competing with hospitals and immediate care facilities, clinics, nursing homes, pharmaceutical companies for a limited amount of Medicaid dollars. The things we need to remind people about a lot of those emergency care clinics and hospitals and emergency rooms is that they're taking care of crisis situations. What we mostly do in schools is prevent those crises from happening. We get involved early. They're able to provide the students with the medical care that they need. The things we also need to remind them, it's not only, and oftentimes in many places is the school the primary medical provider for the child, but in some cases the only medical provider for a child. So if you take that medical provider out, then what's going to happen when this kid gets sick and where is he going to end up? And when he doesn't end up at the emergency room or the immediate care facility clinic, it's going to cost a lot more money to provide services. So we need to remind people that that's what we're working on, that's what we're working towards. And that is especially true in those schools that are fortunate to have school-based health clinics. They're able to access all kinds of health care. So, next slide, please. Questions that we need to talk about and we need to consider is what do students in schools in your particular state need, and what policies are there, and what policies need to be amended or established in order to meet those needs. We need to be working harder at figuring out how the education and Medicaid administrations in each state work together, and that because money is going to be more limited, there are some cost efficiencies. And in many cases, we all recognize that in most states, the school-based Medicaid program, especially for those services that are provided within a student's IEP, are a very efficient way for states to provide services because they do not necessarily require additional state funding. They utilize their Medicaid match funding from existing education dollars. So it is a very, turns out to be a win for the state when they're able to do that. But we are going to have to hold on to them because more people are going to be outreaching for those rare Medicaid dollars. We need to be able to tell stories about how this works, how it benefits the kids' education, how it benefits their health, their overall health. As was mentioned earlier, kids that stay in school, kids that have Medicaid coverage, of course, they're more likely to graduate, more likely to go to college, more likely to have a higher income paying job in the end. We need to be reminding people of that, and those are the issues that the states will need to be looking at, and we need to be looking at as we try to remind people of why this is important, regardless of what happens to healthcare. School, next slide, please. Yeah, just that we need to, again, remind people where we're at, what the opportunities are. We heard people talk earlier about the different opportunities that are coming under the ESSA, and then we do have a lot of unmet healthcare needs, and that our school settings are are in a very good place to be able to provide those. Again, as long as we have the extra money funneling in through the federal government. Next slide. What you need to make sure that you do at the local level and at your state level is involve all your stakeholders. That you need to get the elected officials and your senators, your governors, your state representatives. They have to be aware of what it is, what you're doing, and why it's important. Your school districts, your school teachers, your unions, and any other school-based allies need to understand why it's important and what it is you're doing. Their voice will carry far. Healthcare providers in the community and your community health centers and your community mental health centers recognize what a role the schools play. You need to keep them in the loop. They need to be out. You need to build those into your advocacy works that you're doing, along and especially with parents, because the parents are the ones that will call people and say, look, my kid is having this issue. Why is this program being cut? What are you doing about it? They definitely need to be involved in the process. And of course, whatever media and social media outlets that you have to continue to remind people on the important works that schools are doing around the healthcare centers. Next slide. And what we need to do is to make sure that we're connecting all the efforts, not only within a state, but even from state to state. Educate and advocate for state actions. You got to build relationships. Technical assistance to the policymakers and the state teams to make sure that they know what's going on and the best practices that are out there, and to collect the data that shows of the successes that we have, and then also to make sure that you develop resources and materials for people. And I think I'll turn it back over to you, Alex.
Great. Thank you so much, John. I really appreciate that overview. So we have a few minutes set aside for questions here, so please feel free to send your questions in through that questions box for the presenters, and we will just go ahead and dive right in. So first question for any of the presenters is just wanting to know kind of what happens now on healthcare reform. I know, Sasha, you mentioned it's in the Senate right now. I think if it would be helpful if you could provide a little more details sort of about what happens next, what's the timeline, and any insights you have in what we think is likely to happen. So I don't know, Sasha, if you maybe are able to kick us off on that, that would be great.
Sure, no problem. So right now what we're hearing on the Senate side, and this is as recently as yesterday afternoon, is that leadership in the Republican Party are eager to try and ram this proposal through. The staff are actually drafting their own version of the House bill, the American Health Care Act, and it will be quite different from what the House passed, but I think it won't be different in the sense that their goal is still to disinvest in the Medicaid program and to move towards some kind of block grant for states. that will jeopardize health care for kids and for all their Medicaid beneficiaries. That's the bottom line. So from our perspective, we're urging a transparent process. We want them to hold hearings. There was never a hearing held on the House side. We want an opportunity for there to be collaboration and consultation. There are several moderate Republicans who have signaled over the past few days and weeks that they are not at all fans of what's being drafted or what's being discussed in their own party. And in order to move this bill, they're going to need every Republican to be supportive of it. So or at least 50 of them, I should say. So almost every Republican. And it's not clear that they have the votes right now, but, in the House process, we didn't know until they actually took the vote whether they would or not. That's why it was such a close vote in the House. So I think it's going to really depend on what happens in the next few weeks. McConnell, who's the leader of the House, said, he's looking at the town halls that are happening this week and the way his members are being treated at the town halls and the reactions in the public. What that says about the need to move this bill forward quickly or to slow down a little bit. So I would say that, the number one thing you can do if this is a concern for you is to be reaching out to your senators and letting them know what concerns you may have, and taking John up on what he said about engaging in social media activity, engaging in any kind of advocacy that you can to make it known to them that this will really jeopardize your school district programs and the life of kids that you serve. So
and
that's
Alex,
kind of the list of.
This is Lena. Can I just jump in and add 2 sentences? So everything, I cannot underscore enough all of what Sasha just laid out. I want to lift up, though, that this is a lot of uncharted territory for the Hill. It's nothing is going quite the way you expect, and as Sasha said, things seem to come together really quickly. And also, time is on our side on this, and the more difficult it is to come to an agreement, and the stronger the opposition, the better, well, the higher likelihood that these programs that we care so much and do so much for the kids we all serve are able to stand. So many adults, so many parents, so many different communities are impacted, and lifting a unified voice is critical. I will say that one last thing, which is there are lots of points of influence here. To those of you who live in states that have Democrats, they need to hear the message just as strongly as Republicans. There are lots of different time points. I mean, if the Senate passes something different than the House, it will have to go back. So I want to just lift up Sasha's message that if this is a concern to you, now is a great time, but that also this is a marathon and not a sprint. And there will be, gear up now and gear up for a longer term too, because we need all the support we can get.
Great. Thank you so much, Lena and Sasha. Just a few other, I know there are a lot of questions that are coming in, and so I apologize if we don't get to your question. We'll be sure to follow up after the webinar. So one person wanting to know, just for clarification, if Sasha or Lena, I think this might be best for you, if you can briefly explain how block grant funding works.
I'll leave it to Lena.
Okay, so right now, here's Medicaid Financing 101. I'm going to be super brief, but there are lots of great resources about this, so we can collect some of those and post them near the webinar because it's good stuff. So the way Medicaid financing currently works is for every dollar in healthcare spending for a Medicaid beneficiary, the state pays a certain percent and the federal government pays a certain percent. So for all beneficiaries, for all their covered services, if a dollar is spent, the state, I'm making this up, pays 50% and the federal government pays 50%. So it's called the FMAP. And it's a formula, and that's the way it works. But it doesn't matter how many what that upper limit is. The federal government is always going to be there to match what the state spends on what services people need. And that's the way the entitlement works. What a block grant does is says, all right, the federal government's in for $1 million, full stop. And it's not like healthcare needs go away, and it's not like people need less services, but at a certain point, at a hard line, the federal government stops paying any to the state to cover these services. A per capita cap is a little more nuanced than that, but in effect the same. A per capita cap, as the name suggests, caps an individual's spending on average. And so again, at a certain point, the federal government's commitment to paying for health care for the Medicaid population just stops. It just turns off the spigot. And any additional services that are needed by people who are on Medicaid, the state still has to provide those services. But the cost of those services then are entirely borne by the state. Or the state is forced to look to ratchet down benefits, ratchet down who's on the program, cut other parts of the budget, or cut provider payments, which are already dangerously low to ensure access. So that's the 30-second version of per capita caps and block grants. I think you can see why the impact on state budgets would be profound and damaging. But as I said, a lot has been written on this topic, and we can collect some good resources.
Great. Thank you, Lena. And we will do one more question before we wrap up. Somebody expressing, I guess, frustration there with a local LEA and saying that their state Department of Education is resistant to work with their state health department and wanting to know if there are any suggestions. So I can respond very briefly, and then John, I thought you might have some insight to add as well. This is where, depending on what state you're in, I think potentially the Every Student Succeeds Act could be very helpful here, in that emphasizing to the State Department of Education, depending on what they have chosen as their measure of school quality, whether it's chronic absenteeism or another measure of school climate, and just the fact that chronic absenteeism is a required measure within the state school report cards. I think emphasizing that to state departments of education is a really important way of elevating health and wellness. And we know the research tells us that health issues, especially in the younger years, are leading cause of chronic absenteeism and attendance issues. And certainly, the health agencies and health departments can play a really important role in helping states and school districts think through how to address some of the health-related causes of attendance issues and school climate issues. So I would certainly, recommend emphasizing that and making sure that that connection is on their radar. John, I don't know, given that this was one of your main roles in Indiana, was liaising between the Department of Ed and Medicaid agency, any suggestions on how to support collaboration between state ed and state health?
Well, the first thing you got to do is figure out why one party doesn't want to play with the other party, and figure out what that's about the best you can. There's lots of different reasons, and that varies from one area to the next. If whoever had the questions, if they want to reach out to me, my contact information is at the end of this webinar. Please send me an email, and we can see if we can come up with some suggestions on how to move that forward a little bit in some potential ways.
Great. Thank you so much. So we are going to go ahead and wrap up the webinar. Thank you to everybody for staying on a little late. Here is our contact information, so please do not hesitate to reach out to any of us if you have additional questions or would like more resources. We will also make an effort to respond to the questions that we weren't able to get to in the question and answer session, and appreciate you sending those in. The webinar, again, it will be recorded and the slides will be archived. We'll be sending out a link to both the recording and the slides shortly. Most likely it'll come out mid next week, so look out for that. And just thank you once again to everybody for joining us today. Thank you to our presenters for sharing their expertise around these topics. And we look forward to bringing you more information and resources through a follow-up email next week. So thank you, everybody.